Data on its own can be quite dry and non-engaging. Patient stories on their own can just be dismissed as anecdote. But combine the two together and it can be incredibly powerful.
I suppose I always took it for granted that we would be focused on the patient. But every meeting starts with the patient story. It brings everybody in the room round to remembering why we're there and also why we're in the room trying to improve the service.
This story is about an 80-year-old gentleman admitted to Bailey 7 early January with pneumonia. He was previously living with a partner in his own home. The MDT felt he was fit for discharge on the 3rd of February.
It's about looking at it from the patient's perspective. How do we remove the barriers and for the patient make it seem integrated? Because that's where the quality and efficiency gains lie.
What we did with the Falls Clinic was we felt that as a multidisciplinary team everyone was very focused on their own area.
Integration actually means making the patient's experience a smooth, efficient one. It means having a system designed so that patients receive high quality health and social care as a system rather than sets of separate silos.
What we decided to do to focus the team in on getting the patient in the centre of the redesign was to create a virtual patient who were called Evie.
So we used Evie as a sort of test case and sort of looked at the whole process that we already had in place for fallers, and each section of the pathway we sort of directed it right around Evie and seen what she felt was needed.
And the team came up with things like she doesn't want to have to wait, she doesn't want to have to walk around a large department, she doesn't really want to be here for a full day.
Project Evie has completely changed the way that clinic runs. It's a much better service for the patients. It flows better, it takes less time, it's not so tiring for the patients.
It made a change in the teams because they started to work together around the focus of the patient as opposed to this is what OT need to do, this is what physio need to do, this is what the medical element is. It's all about the team working together.